generally, you know that we're just coming to the peak now. I think Africa is really going to feel the health impacts through the month of August, September. But several months ago, African states responded very fast, which at least I think has given those that are sensible and serious the time and the space to prepare. So states move fast to lock down, to either through, border closures or curfews or quarantines, states of emergency, basically all intended to stop or slow the spread of the disease. Unfortunately, what that meant was, in replicating, I guess, procedures that had been taken and in countries that were already sort of heading towards the peak, was that people were really economically impacted before really understanding how grave it could get in terms of health. And even though governments put in place, a range of different measures to support big business, support small and medium-sized enterprises, to raise social assistance programs. People have been really gravely economically affected. Food supply chains have been affected. People's incomes, livelihoods have been really gravely hit. I think what we tried to do as OSF, as the OSF entities in Africa, was in the first phase of the response, I think all together the African entities, the four foundations plus Afro, put in about 5 million of our own money, as well as 5 million of additional money. And that was really intended for preparation, really primarily around the health response. So we were supporting locally generated research and analysis to provide the public with information on COVID-19. We were supporting community-based and national health providers. Afro made a $500,000 investment into the Africa CDC. Under that, we were supporting access to health information for particularly vulnerable communities. Girls and women, minorities, the elderly, people with disabilities, and high-risk populations within the poor majority. But then recognizing as well that affecting the lockdowns, the curfews, the states of emergency had already had massive impacts on human rights, on the economy. We also invested in sort of documenting that, analyzing that, beginning to put forward policy propositions around how to deal with those unintended impacts. Moving to the second phase, we did a joint Africa strategy for which we've gotten an additional 10 million. And that's going to be going towards sort of two sets of interventions. One is dealing with the sort of effects on constitutionalism, human rights, rule of law, and democracy. And the second is really dealing with the economic reconstruction and recovery efforts. The first phase was really understanding that we were in a preparatory phase and was really geared at supporting community public health workers, national public health workers, as well as the extraordinary coordinating work at the continental level being done by the Africa CDC. So the first phase was really around health interventions, but also, like I said, beginning to recognize, wow, all these steps that have been taken to flatten the curve have had huge effects in terms of democracy. We've seen what happened. Some elections have been postponed, some have gone ahead. Not all of the ones that have gone ahead have been held in conditions conducive either to public health or to people's exercise of choice and participation. Low voter turnout, questions of illegitimacy, and so on. And then the ones that were postponed raised real constitutional questions around constitutional elongation of terms, whether for executives or parliaments, that created huge tensions in different places in the world. The second phase, like I say, is still picking up on these questions of human rights, constitutionalism, rule of law, and democracy. And rights, the questions were obvious. I mean, the ways in which these lockdowns were enforced, that's obvious. Many people have said all across the continent, more people have died from police action, enforcing lockdowns, curfews, states of emergency, than have died from COVID. So that work has continued, but also human rights in an economic sense. People are desperate. Those who, Africa is not really the people for whom, the idea of working from home is a possibility, is such a tiny, tiny, tiny minority. When you're reading stories of women cooking stones for their kids, people within the informal economy who live day to day, whose incomes are day to day, they've been terribly affected. You've gone from a situation where you had one whole class of people able to basically, live, who've fallen off the edge into poverty. So those are the kinds of questions that we're thinking of in terms of supporting in the second phase efforts around economic reconstruction and recovery, that deal with questions of, okay, how do we seize this moment to really push up the scale policy propositions for real investments in social services, education, health, social protection, which includes social insurance as well as assistance schemes. So that's what has informed us, is really, on the one hand, looking at what this has really revealed about needs on our continent, but also what it's really revealed about Africa's incredible, innovative, creative capacities in the face of this. So I think we've seen, like I said, a lot of innovation and creativity, including from young Africans, but also from areas that have also been underinvested in for years, like higher education and research. All across the continent, we have examples of small and medium-sized enterprises, big business, pivoting to be able to produce personal protective equipment, whether it's masks. We've seen innovations in terms of people producing ventilators and trying to sort of find innovative ways to create supplies of oxygen. So there are real opportunities, I think, this has created for the social impact investment field, and real sort of impetus around regional integration, collaborative kind of platforms. We've seen Africa create a common procurement platform for PPE, and I think that's what all of the OSF entities are looking for. Where are the gaps, but the gaps that can be seen as opportunities to really advance economic and social justice on the continent that will be lasting into the future. Africa's intellectual capacity, Africa's innovative capacity, Africa's creativity. We've seen African thinkers come together in ways that we haven't ever before. There's a massive platform of Africans here, Africans in the diaspora, of, some of our best thinkers sort of putting their minds to different areas of intervention, not just in their own countries, but also in terms of what they can learn from one another. So for me, that's the sort of lesson. And we've seen, suddenly people are taking the idea of expertise seriously. If you look at media and who's being talked to nowadays, thank God we've moved away a bit from all of these political talking heads who talk about nothing of any substance. It's all about, one-upmanship or preparation 5 years in advance for whatever electoral maneuvers they're doing. And suddenly the media is interested in hearing about people who are skilled, people who are trained, people who are so deeply committed to ensuring not only that Africans survive this, and again, we've seen the incredible level of informal philanthropy, I would say. I mean, I myself know one person whose initiative has fed, I think it was at last count, 4,000 families, supported 4,000 families. That's incredible. And that's just ordinary Africans sort of, this is unacceptable, I've got to do something about it. And when the media is talking about that, when the media is showing that, I think it does provide an opportunity to say, and pressure on our governments to say, okay, you've been serious at the continental level in terms of the response to this. You can't fault Africa for its collective response on COVID-19 through the AU and through the Africa CDC. But you have not been serious nationally, and we expect seriousness from our governments. We expect governments that are actually able to handle this and to get us through. I think all of that is huge for Africa. It's potentially, shifting our expectations of governance. I think it's important to sort of see the kind of incredible responses from our thinkers, from our activists, from our private sector, not as one-off emergency things, but as something that needs to be built into how we construct and sort of move governments forward into the future. There has to be channels where people with expertise, with creativity, with innovation are continually built into our conception of how the public is managed, right? I think what this has shown is our public services have been constrained really by not having access to young, bright things. And there are many. So policy ideas, right? Moving from ideas into policy. I think creating the channels and being open to that and understanding, there's so much experience outside of the state that needs to be built into a loop that can inform dealing with the public interest. I'm really proud of our foundation teams, of all of the OSF African entities. We've come together in a way that is unprecedented. And like I say, we've had a boost of sort of, extra money from elsewhere, but everybody pivoted really fast to make sure that we could get money out fast to these kinds of new initiatives that we're seeing.